The first 1,000 days, from pregnancy to a child's second birthday, lay the foundation for lifelong health. And yet, across communities, critical gaps remain in nutrition, maternal care, and coordination. The intent exists, the expertise exists, the work is happening, but too often it happens in isolation. And children do not experience systems in silos. They experience outcomes. The 1,000 Days Collective was convened by K-Corp Charitable Foundation in collaboration with Dasra, Sitara, and Path as knowledge partners, anchored in a simple yet urgent belief: prevention requires partnership. A partnership that brings together practitioners, policymakers, foundations, technologists, and community leaders working as one ecosystem.
When it comes to health or 1,000 days or anything on that line, we are not just building immunity of mothers, we are building long-term health of the children they are bearing. Nutrition is something that's generational, health is something that's generational. Sometimes it takes years to build the immunity and the strength, so that's why prevention becomes extremely important.
36 panelists, 8 conversations, 140 participants, countless perspectives.
I think I would love for a disaggregated tribal health data set. That's something that maybe in a year or so we need to construct. And if there was one maternal and child health intervention that needs strengthening, it's the VHSND and AAA convergence that we keep doing month after month after month.
1,000 Days Collective is an excellent platform to working on the 1,000 days, which is from pregnancy up to children 2 years of age. It's actually a safe space that brings together academicians, practitioners from the NGO sector, government and donors.
And what was my main takeaway? A point regarding there are too many ideas, too many silos, and what we need is more focus and more collaboration. It reminds me of this point: a city can have a lot of potholes, but you cannot fill all of them. You got to decide which ones to focus on. That's probably the number one thing I took away.
This was not a conference. It was a working room. What began as a conversation now becomes a commitment. Together we move, from prevention to partnership, from silos to systems, from dialogue to action. Because when we strengthen the first 1,000 days, we strengthen a lifetime. This is the beginning of coordinated prevention. This is the 1,000 Days Collective.